It's time for New Wellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Good morning or good day, everyone. I want to thank everyone who's watching the show. I was just informed through my guests that we're having people watch us in the UK. But we normally have people watch from all over the world, and this is a worldwide problem. So today, the title of our show is Test, Don't Guess. And I've used that terminology before, test, don't guess, because prevention is the key. Prevention is the key. So if you test, don't guess, you can receive a test in 5 minutes to let you know the level of your toxic metals in your body that are playing havoc on your health. So you are aware that many heavy metals can be contributing factors to a lot of disease happening in our body. We just had a nice long talk, my guest, and it's a lot of things that I've been doing for years, but I was testing a different way. And then the patients had to wait, 2 or 3 weeks to get the results back. Now we can test and not guess in just 5 minutes. So I'm so happy and thrilled to have Mr. and Mrs. Fessler on my show this morning, Michael and Elizabeth.
Hello, Dr. Lee.
Thank you. And you look wonderful. You're about the happiest couple I know. You look so happy and loving together. And I know that's not a front, because I've been knowing you for years. And you always have this glow around each other like newlyweds. God bless you both. And thank you so much for being here today. We're going to kind of jump in because of, we did part 1 last week. And but this week, we're going to dive in a little bit more, especially with different conditions and things that are happening in the body. So I'm going to let you go ahead and pick it up from here. Why, and I know why, but you're my guest today. Why is it imperative? I don't care what condition you have, or if you have no label conditions, why is it imperative that everyone from the ages of 7 and up be tested? Okay, I'm going to let you take it away.
Well, let me say that in most tests we have accessible to us, we look at the blood, hair, and urine, and it doesn't, it's something taken out of the body. The hair's taken, the urine sample's taken, the blood's taken out of the body. So it's not representative of the entire body dynamic flow of fluids. And with the Oligoscan, we discovered that we can look at the mix of heavy metals and minerals. And when people start to look at their heavy metals, we were able to determine now that what amount of toxicity are you carrying around without you even knowing it. And this is becoming an important health factor, in that if you have the wrong type of metals, if high cadmium or high lithium or high mercury, that this may be contributing to your future health factors. So we like to people at least know that what's in their body, and to be able to enact and enable themselves how to keep those from accumulating. And
Most
so
definitely.
that's where we'd like to start from.
Yeah. And the thing is, a lot of people feel that I've done detoxing, I'm a vegan, all these different things, so I should not have this problem. When indeed, you could be detoxing the wrong way and have these metals ping-ponging through the body, especially not filtering through the lymphatic system, which we spoke about a little bit last week. But the lymphatic system is so important. You've got to know why it's blocked. Why it's blocked and what heavy metals. So every condition, which if you receive my email, you know that I listed a number of conditions, that are linked to it. um, a number. So if you know anyone with, I'm just going to kind of go down the list because somebody knows someone with fibromyalgia, Parkinson's disease, dementia, um, just feeling overall fatigue all the time. There's so many conditions that are linked to heavy metal. And once you start chelating, detoxing this from the body, you're going to feel better. So you can take supplements for a medication, as some still do, for all these conditions, not knowing that you've been plagued with a heavy metal. And maybe some foods you might need to omit for a while until the body is balanced. So this is the one reason why we're covering all this, because of the many, many, many conditions. MS, you don't have to have it yourself if you know someone. Hypertension, that's a big one. Cardiovascular diseases is a really big one. So even with myself, people know some of my history of being in a coma, and I've come to find out it was linked to, I thought it would have been, lead from years ago or something, but it wasn't even that. It was still the aluminum. I was doing a lot of flaxseed at the time and not knowing certain flaxseed have cadmium that if it's the dark in color. And there's so many other things, your jewelry. So, we're just going to go through, not to say you're going to basically run around naked and don't eat any food, but what we want to do is make sure what we're putting on our skin and on our body is there to nourish us and to heal our body. We pray over our food, we do all these wonderful things, and we're protected. But you want to know, because not knowing could be your life. It could be your loved one's life. And that's the reason why we're doing this show today. So I want to say that I am thrilled that there is a machine or device that we can do early screening, prevention. You might walk around and say, I feel great. Let's test you anyway. Test and don't guess that you just feel so good. You want to know what is going on and playing havoc in your body before the symptoms show up. Because a lot of things are under the heading of silent killers. Silent, meaning you have absolutely no symptoms until you drop dead. So you want to know these things. It's so imperative that we utilize prevention. Prevention is always the key. And I have to say that because just in the last week, I've had at least 25 calls from all over the world. It's probably more than that, of people with all kind of conditions, especially, unfortunately, I don't like the C word, but we want to, even with that, I find so many heavy metals in people with those type of conditions and those type of diagnoses. So you want to know, where is this coming from? It's like peeling the onion to help unveil all these things that are happening in your body, playing havoc with your health so that we can turn this around. So I am just so grateful to have the couple that's here with me today. They're just amazing. I just had to say that and get that out because there's just too many people. I mean, even while I'm sitting here, I'm receiving calls. There's so many people with so many unexplained conditions. And you will heal so much faster once you know what the heavy metal is and why the lymphatic system is blocked, and start getting that unblocked. So we're gonna kind of jump in now. I'm gonna let you jump in, and let's talk about what do we normally see with high blood pressure.
We see usually on high blood pressure, the lymphatics are suffering from not circulation. Usually associated with that is a compendium of heavy metals like cadmium, mercury, high aluminum. We'll see maybe lead at times. On the other side is that these metals, heavy metals, work against certain minerals. So we see low magnesium, we'll see low iodine, we'll see the calcium is starting to erupt. It's like being depleted, because as we've understood the Oligoscan in interpretations and in doing repeatable scans, we see that the heavy metals are associated with that. The calcium is kind of like the egg. It's like when you have an Easter egg and you put the dye on it, those are usually aluminum dyes, and you put it outside, they don't degress. They don't leave a stain. But that's what metals do. They're picked up by the calcium in the body, and the body takes the calcium, it's trying to get rid of it. And so that's where the lymphatics come in, because now the lymphatics start to get backed up like traffic. And unless that's resolved, we're not going to see the minerals work.
Mm-hmm. Most definitely. And, you know, I want to kind of jump in a little bit, because when we look at heavy metals, we also have to be aware of our minerals. And, you know, heavy metals play a major part. So I want to kind of go into the interpretation of aluminum and its effect on your sodium and potassium. What is happening there? And what organ systems are being affected? I mean, it's just amazing, just aluminum alone, the function, the correlation, and what happens to have it in imbalance. So what happens in a human body when you have too much aluminum? What nutrients are going to be affected? We know the sodium, potassium channel blockers, and we not so much channel blockers, but I want you to go into a little bit more detail on that, please.
Okay. The chart that was just put up are the scientists that have worked with different diseases to show the varying amounts of aluminum that was found in these.
Yes.
So, and this has expanded since this was done, this copy. But what aluminum does as a salt, the body breaks it down, and it affects it kind of builds up the sodium side. So it creates artificially hypertension on the sodium side. And the pumps have 3 sodium ions and 2 potassium ions. And what happens when there's too much salt outside the cell, it starts to get inside the cell, and it expands. It creates hypertension of the cells. So you can imagine all the cells are picking up on aluminum, and it's not being able to get rid of it enough. And so this is the start of affecting the potassium channel, because the body's not able to get work with its potassium because it's spending so much time on the sodium side. Exactly. And the other part is that we're seeing that the magnesium, trying to work like an oil derrick, it's trying to push it up and down. It's depleting all the magnesium in the body to work with the aluminum to try to get rid of it. As that's working, the calcium in the body is trying to bind it like the Easter egg and get it out of the system. And so we're seeing that the magnesium, the calcium, sodium, and potassium are all affected by that one element, which is not being tested by very many people, but with the Oligoscan folks.
Right. And we have that at our clinic at New Wellness Healthcare. I'm so excited. But I want to just go, since we're speaking on the disturbance, the sodium potassium imbalance, which is so important in the body, you know, to know that all these conditions are linked: Alzheimer, your motor skills, people who have like Parkinson's, arthritis. People have a lot of problems. I hear that every day. I have arthritic pain, you know, in my knees and my hip. We'll talk about a little as we go through this about the titanium replacements. We're going to talk about that as well. But all these chronic conditions, especially COPD of the lungs, asthma, which I've had a history of in the past, chronic fatigue. You know, there's so many vascular problems that people have, not knowing what the cause is. So when you test and not guess, you go through everything. You can go to heavy metal testing, lab testing, and I don't mean lab for heavy metal, I mean your overall blood testing to see where you are, and we provide what is called functional, so we can find out the functionality of your body and what's really happening at a cellular level. So you're not only finding out what's happening at a cellular level to make sure you're in optimum health, but now you're going to find out about the heavy metal. And it just brings tears to my eye, as you see, because of the fact there's something out here that can help us to help ourselves.
Yeah, I will add one other item, is that the prostate is an organ that can accumulate a lot of aluminum. And we find that when we started working with aluminum back in 2004, actually earlier than that, we wanted to know all the sources of where was aluminum coming from, and that opened up Pandora's box.
I'm
There are
sure.
so many places aluminum's coming from, and it was 4 years ago when we first started to work with the Oligoscan, and we started to see these levels of aluminum and then the other heavy metals, that it really tells us we have to be very conscientious of what we're eating, what we're breathing, and what we're drinking. In
Exactly.
fact, on the news today was the concentration of contaminants of heavy metals found in fruit juice.
Yes. And this is fruit juice in a can or fruit juice in plastic. Now, I know in
In
plastic
in
there you're going to have
Yeah,
other contaminants because it's plastic.
well, it's actually derived from even in the processing, if they're using aluminum in any of the material, um, they're picking up something. And we know each vegetable and fruit are chelators for certain heavy metals.
Yes.
They're not, if it's put into the soil, it could be absorbing. And here on the breakfast cereals that we know it's absorbed in corn and wheat products, it's absorbed by the additives in the soil and from the soil itself. So here's 28 point something. One of the highest amounts of aluminum people get every day is in their breakfast cereals.
Can you imagine that? And so many people, I mean, you go in a store in a supermarket and you see row after row after row of all of these breakfast cereals. And most of them are not gluten free and a lot of them have wheat. But I just want to still go back because I had someone told me even over the weekend they're going to be coming in to be tested that they were recently diagnosed with an intestinal problem, which is, they said it might be Crohn's or IBS. And so I told them, you have to come in for the testing. Let's see what's going on there. Because people don't realize leaky gut means leaky brain. So if you're having leaky gut in the colon, best believe you're having some problems going on in the brain as well. There is a strong correlation there. So pulling out this heavy metal is important. Test, don't guess. I don't even know how many times I can stress this. Test and do not guess for prevention of your own life. So I even have patients who have sarcoidosis. That's another one. You want to look out for your heavy aluminum in the body. I did mention asthma, obesity. People sometimes just having major problems losing weight, and we know that we're in an epidemic right now, a pandemic of just obesity. Test and find out what's keeping you. Candida is linked to heavy metal. So we want to make sure with the aluminum, and we're just mentioning one heavy metal right now. Can you imagine? There's so many others that's going to cause a disturbance in your electrolytes, a disturbance in your potassium and sodium that has to be exchanged to the body. So I'm going to let you go ahead because I had to bring up, and also diabetes. I forgot to mention diabetes because there's so many people who are diabetics. So why is it that our establishment don't do some of this? I think there should be one in every hospital. But I am blessed and honored that I have the Oligoscan at my clinic. So, call me, let's get your appointment going so you can find out so that you can heal faster. If you know what's going on, you can take steps to eradicate it.
Thank you, Dr. Lee. That you're spot right on. On diabetics, we usually see on the Oligoscan that they're not able to excrete heavy metals because of the circulatory problems, especially in the lower extremities.
Yeah, the peripheral neuropathy.
The neuropathy, and also we look at the bottom of their feet and we see that they're calloused and they're not able to sweat enough, and it's backing up into the lower leg, and actually they have all this uric acid that needs to be neutralized, and they need to, it has to be worked on. So the first part is trying to regain the circulation in the lower leg so we can get rid of those toxicity. And we do know that that it's linked to heavy metals. It can affect the kidneys, and so the preventing and treating that for the heavy metals to begin with is really important.
Yes. And then, when we look at the other ones, we have the aluminum, and now we have the sodium, potassium, which we know there's a relationship problem there. The calcium we spoke on, magnesium. People come into the clinic, and I do what is called the Myers cocktail. A component of the Myers cocktail, which I do a modified version of the Myers. But part of that that's so needed is potassium. I'm sorry, not potassium, but magnesium. So I want you to go in more detail on why we're being so depleted of magnesium. This is why people, they have the IV and they feel so good, is because part of that cocktail is magnesium. So I want you to shed some light on that for me. Thank you.
What we've been able to find, and we will in another time when we can, we're going to show comparisons on the thermography. I mean on excuse me, on the Oligoscan. And on the Oligoscan, we've been able to pinpoint that every time we see high aluminum, we see low magnesium. And that was very common. And when somebody came back and retested, and we started to work with them on detoxing them on the exterior of the with the skin, and then interior wise, we're able to see that change. But there is a link that when you have high aluminum, you're going to be utilizing all your magnesium stores in your body.
Mhm.
And we have people taking oral magnesium and they can't keep up. And
Yes.
so that's why the skin is an important feature to do a bath in Epsom salt, which is a sulfur and magnesium.
Hmm.
And that starts the skin to sweat again, and allows the aluminum to be offset. Do
Okay.
you want to say something on that, Liz? I think
I just want to add one little statistic regarding aluminum and the Oligoscan. Those that are being tested according to Oligoscan throughout the world, 90% of those tested are highest in aluminum. And aluminum has no benefit to the body whatsoever. And on top of that, when we have too much aluminum, it impacts not only what we're seeing here with the increase of other heavy metals and the decrease in minerals, but it actually affects medications as well. So if 80% of the people
Yes.
that are on medication are going to see an impact of how well that's working for them because of the influence of aluminum.
Right. And I'm glad the machine is portable. So we'll have a show later and show some before and after, and show people just how fast it's done. And not only that, we'll show the report. I may do it on myself because I've come a long ways, but still, I'm still working on me. I'm still breathing this air, excuse me, that's high in aluminum, and there's certain other things. So I don't use aluminum deodorant, but we know this also, filters into the breast tissue of women. They've done autopsies and found aluminum in the brain for people who have died from Alzheimer. So all that research is out there and it's old. Something I just saw too, that in the media is about the jewelry people are wearing. And I'll let you go into details about which heavy metal now people are getting in their body from wearing jewelry.
it was we did several I think about 2009 we did had a clinical. We sponsored a clinical for fibrocystic breast health issues, and we make product here at Herbalix Restoratives, and we make a breast cream, a poultice, and the detox deodorant for the underarm. And we were using thermography. This is before we knew about the Oligoscan, before it came out. But we found out that when we noticed that they were just doing a thermography scan of the breast, we said we need to expand the picture of that to include, up here. We wanted to see the thyroid, we wanted to see the teeth. But lo and behold, that when they were doing the subjects, we saw somebody wearing just the bottom of an earring in the scan, and we were able to determine that the earring was actually infiltrating inside the lymphatics and coming down and blocking a lymph node in the subclavian area. And then when
When we say subclavian, we're going to show people, on the body where that's located. So also your cervical lymph nodes here and the neck, those are going to be blocked because the earring is right. Well, I have on some today,
Yes.
but it's blocked. But I do have mine tested. Um, Try to every time. but it's also right in here. So you're going to have here subclavian, then it's going to find it there in the neck area, but also moving on down. I'm
That's
sorry.
great.
Go ahead.
And in addition to that, we when they took the earring off, we were able to see the changes in the cervical lymph nodes. They weren't as inflamed.
Mm-hmm.
And also that if you're wearing earrings or even amalgams, that they can get into the thyroid at this. We figured they can get into the thyroid because we saw a lot of inflammation in there. And so that kind of alerted us
Right.
about what's in earrings. And Dr. Howard Maybach, a dermatologist, did a clinical on, they went out and got jewelry on the streets. They went to different stores and they bought this cheap jewelry, and they found 60% of the jewelry had cadmium, lead, beryllium, all this mixed metal in it. So the body, and it's able to absorb because it's so efficient. It's bringing these metals back inside the body, and so we caution folks to get their, gold is fine, but if you hold a cell phone to it, it's a ground. So we caution people to be.
Say that again. Oh my goodness.
Yeah, if you're wearing an earring and you're holding a cell phone, that it's finding a ground in that ear. Mm-hmm. That's a meridian point. A battery, yeah. And so we know these metals once they get in, and we teach women to kind of palpate right here. These are sore.
Yeah,
they need
right in here. If people can
right
see me,
here.
right here in the chest. You can do a circular motion right here just to see if that area is tender. So, men too, because men wearing earrings now. So not just the women. So we can palpate, go in a circular motion, and see if that's a little tender.
Yeah, and verbally we have people in the audience, and we'll hear somebody go, "Ouch," and we, there's a way to work with that we've been able to do, and but at least if you have that, it's time to get in and get your, get a test.
Get a test.
Lee, don't take, and we know how to back route that from the underarm and open that area up. But
and can I just say, we're giving out, I don't mean to cut you off, but just for a second, we're giving out a lot of valuable information. But I want to let people know there is a solution to the problem. So don't just listen to all this and say, I don't want to hear anymore. I don't want to know that I'm sick. Because a lot of people just don't want to know. But best believe there is a treatment to this problem. So there is a solution. So stay with us throughout this show, and you will know that there is definitely a solution. You don't have to have that, because I used to have a lot of tenderness here from years ago because I wore the really big earrings. When I was, a lot younger, we wore the real big earrings. And actually one night I went to bed with some earrings on because I was just so tired. I had been out all day and half the night, and woke up the next morning and was combing my hair and noticed that my ear was split. It was totally split. And I'm thinking, oh my goodness, how did that happen? So I went back to see if there was, there's bleeding anywhere on the pillowcase. There was no blood, only because my body is high, and I test my levels of vitamin C levels. So I keep that level high enough that the tissue just healed while I was sleeping.
Yeah. So there's a lot of points we can touch on, but I think that we cannot go and put our head in the sand about heavy metals.
We cannot.
Because we really want to have a good lifestyle. And if we learn to detox early, and we know what we're detoxing, and we have a detox guide of what we need to do to get where we need to go, then when we retest, we see the results. It's like, you have a crystal ball, you can forge your own future.
Right. And then when we talk about detoxing, we want to be very careful with detoxing with certain supplements and certain juicing, because some of these, even our food, pulls up a lot of toxins. So we want to do that right, and you should seek someone like myself or a practitioner to make sure you're detoxing properly, because if you are trying to detox and we find out that your liver is heavy burdened through some other testing we do, there's phase 1, phase 2 of detoxing the liver. So you just don't go start detoxing because you might start having some kidney issues. Things may shift to the kidneys, shift to the liver. So you want to detox properly and do it very gentle. And I know the products that you have and the ones I've been using in my clinic for years are topical. So you can do this in a very gentle way. And you can feel yourself, I have, even from food poisoning, overnight, and just use one of the belly freedom from food poisoning. It was amazing how those toxins actually went through my body, just subdermal, using something topically, and then taking something maybe internally. But be very careful with going out, taking a lot of different supplements and doing this and doing that without knowing what you're doing properly, because you can set yourself up for some many problems.
Can I add? We've had many people we have measured after they've done internal detoxing without realizing, and they were actually from practitioners. They were doing some internal detoxes, and when we got to them, their kidneys were blocked. They just recirculated all the metals. They were nauseated. They were sick. They had fog brain. And so we tell people the skin is the most important part and the biggest organ in the body to start with. And
Yes.
It's very simple, done at home. And it makes a difference because we're seeing these on the Oligoscan. When we go to these conferences and people are doing these kind of, they're not following the heavy metals and detoxing correctly.
And sometimes people think that there's just, the routine, your mercury, your lead. We know that in Michigan there was major problems with lead in the water. We don't have to go that far because we have it right here in California and South Central. The water actually comes out brown in color, and then they wonder why they have so many kids in those areas with learning disabilities. Well, they're in a very toxic environment. And I think something should be done about that, but that's a whole nother show. But I just want to say everything should be tested. So when we talk about lithium, I want you to go into a little bit about lithium as a metal. We know people go on lithium for manic depressives. That's something a little different. But I want you to talk about lithium as a metal, and too much of it in the body what it can cause.
Yeah, well, we know from prior that people who had been bipolar and they were prescribed lithium, if it was not watched, if they just took it, they really could knock out their kidneys. And so that's one thing with having too much high lithium. We actually find a lot of people are go low on lithium sometimes when they take too much vitamin D. That's one of the attributes of D, seems to deplete the lithium. And the Oligoscan, we're able to follow this and watch very closely. In fact, I think it was somebody that you were treating that we pretty much traced that the person was wearing a wristwatch.
Yes, exactly.
Leaching, the lithium was probably leaching from his battery in his watch.
Mm-hmm.
We see some farmers that have high lithium. We're not sure where that comes from, but and lithium is supposed to be depleted very quickly, usually. But but usually we find low lithium, and when we see that on the Oligoscan, a tablet, break it in 4 every 2 hours, a couple times a day, and we see the change and then you can tell the person, well, this is you're following a good plan, so you can increase it or decrease it. Where I don't know how they do the lithium with allopathic medicine. It's a guess.
Well, I don't even think they even test for it. After reading up when I did this test on one of my patients.
I was being very kind.
You have a couple good dietary sources too. Seaweed is loaded with lithium as well as beets.
Yes.
And drinking water.
We just want to make sure that we didn't have a seaweed that's laced with Fukushima because of the fallout in the water. So, we do all we can that everything is going to end up being a little toxic here and there when we try to put good things in the body. But again, we have to bless our food, and we know God will take care of it. but do the right thing. Just do the right thing, because we're not going to take poison and say, bless it. And we're not going to do that. So we do the best that we can. That's what we can do. We know seaweed is wonderful. I know one while we had a problem with seaweed, again, because of the Fukushima fallout. So um, I don't know what the latest is now. I haven't really looked into it to see because I love seaweed. So I want to talk. Have you noticed anything? People who have a lot of plaque in their arteries, have you noticed anything as far as what heavy metal may be attached to all this plaque? Um,
Well, there's what we've been able to find is that when we're looking at what's called the cardiologist called calcium scoring, and I've questioned several cardiologists, and I said, "Have you looked at the association of the levels of aluminum in your cardiologists, your patients?" And they don't have the Oligoscan, so I'm not sure how they're really able to do it. But we do know when you go for your electrocardiogram, they're putting the tabs right over the heart. So they're getting a sodium potassium potential right through the skin that's telling them what's going on underneath. So we do know that some of the plaque is most likely associated with heavy metals, mainly aluminum.
yes. And again, with the aluminum, we're really on this show just hitting one topic because aluminum is so toxic. I just want to sidebar and talk about titanium because so many people are getting titanium knee implants, hip implants, titanium in their mouth for dental. So, what are you finding out with the titanium?
We recently have, well, when we look at a scan, that we can almost tell when we do our questionnaire. We always ask, what's different about the body? Do you have any implants? Do you have any hip or whatever? But we're finding that over a period of time, maybe 10, 15 years, that these titanium implants for a hip implant or a knee can be leaching. And they actually show up on the Oligoscan. And what they can do is create a non-excreter for heavy metals because they, on either hip or knee, many times the person had already had a compromised lymphatic system. In other words, they were not excreting the heavy metals, and when the gravity brings the heavy metals and they lodge in the hip or they lodge in the knee, and it's not able to go any further, it creates calcification within the area, and so the lymphatics can't do their job. So most people don't know that they need to clean that area before anything to make sure that is that it's not a heavy metal problem.
Yeah.
So we do see the leaching, whether it's an amalgam or a hip implant. We can tell that like you may have to go back and have that redone.
Okay. And I just want to say there is a guest that's going to be coming on the show because they're not because they're a politician, is because they had a knee implant with titanium and it left them very, very ill. And I have several people who have had rashes, uncontrollable, breakout on the skin. With this particular person, she's going to come on and tell her own story, but also she ended up in a hospital from heart problems and passed out from the titanium. And they did trace it back over at one of our big hospitals that it was a titanium implant in her knee. So it's just, and how, now it's like, how can I go take it out? I'm up in age. How do I go take this out? So we have been doing a lot of things to safeguard her, and she's been doing really, really well. She's been doing a lot better.
Yeah, and I was doing some research on the liver transplants, and they have found that by just doing a liver transplant, when they didn't repair the lymphatics, the patient got into a lot of trouble, and they didn't really realize how important the lymphatics are of the body. That's the trash portion of the body.
Yes.
And so when they do these implants, they do hip replacements, You want to know if they hooked up the lymphatics or where there's going to be a blockage. That means we have to use a different way to detox that area all the time.
Yes. So, so that was part of the problem there. And I know this show is just moving so fast and there's just so much. But I want to talk about why we have such a big outbreak. We know a lot of it's dietary, a big outbreak in candida, yeast infections. So many people. We know sugar and all the dietary things that are contributed to candida in the body. But, some of that behind that is heavy metal. So we have hundreds of thousands of people with candida albicans. And the whole thing is candida has a big tribe of family. There's not just one type of candida. It multiplies into so many other layers and layers and layers of candida that it also can surface the skin and become synthetic and within the system itself. So I want to say that why do you see so much of the outbreak? Because we know heavy metal is attached to candida itself, yeast infections.
And when we look at the what I call the heavy metal soup, it is the perfect environment to create candida, and the sugar just keeps adding to it. So every time somebody has a piece of chocolate or sugar, they just contribute to the candida. We know in using some people have called having candida, and they'll use a topical product, and what you have is the breakout on the skin is the actual die-off from the candida, and that's part of and people have to get that out of their system. It's not something that goes through just urine and stools. It's coming through the part of the lymphatic system up through the sweat. And so, it's yeast, it's fungus in the liver. A lot of fungus is built into the liver, so it's not able to work with the fungus.
Right.
So yeah, a lot of and we know a lot of
I'd like to just show some things if you don't mind. Starting with the mouth. We have candida in the mouth with children. It's called thrush, and we see that. The candida and the skin, and then candida on the poor little baby's bottom when they have an outbreak. So many things can surface, and a lot of times people didn't know. And then medically, because in working hospitals and clinics for years, we would give them a certain, antibiotic, years ago, and they still do. I just don't work in that arena anymore to help get rid of the thrush or the breakout and the candida in the mouth and candida on the skin. And thank you for sharing that it's, a die-off on what's going on internally. So the word that I just skipped over was systemic. So you want to know that you have a systemic within the whole system of candida, which is also linked to heavy metals, including one of the metals I believe too is also copper. So we want to look at those copper levels and make sure that the copper zinc ratio is in balance. And when that copper level is very high in the body, you're going to have a multitude of problems. So in children, you want to, watch them. It's not so much they have a high sugar diet. It's just that they love picking up things, put it in their mouth that are not all that clean. So with the kids, but then it's going to, their immune system. The sad thing with children, I have to, go into this because I am I don't even know how to put it in words. I think it's so sad that what they're doing now with the children. I had a person take their child that was 7 months old to the hospital with ear infection, some other things going on. 7 months old. You never guess of the antibiotic. This is not even an antibiotic. Guess what they gave this child?
Erythromycin or?
No. If any of our listeners can type it in, guess what they're giving children. Children, babies, 7 years old. And this mother watched them give the prescription to everybody in the ER, in the pediatric ER. It was prednisone. So now has prednisone become the new antibiotic? That's one of my questions. And actually, it's true. Everybody left out of there with a prescription for the kids with prednisone. Why? Because they put the mothers on a lot of the antibiotics at birth. They give them the antibiotics while they're in labor, depending on the strep organisms. They have that in their system. So many kids are so resistant to everything. The only thing they feel that's going to help would be the prednisone. I can't believe you would give an immune suppressor like that to a child. But and it's big in one city, and that's Antelope Valley. So I don't know if this is happening at all hospitals. I haven't done the research, but I know in Antelope Valley, they're giving them a lot of prednisone. I think that's sad.
Dr. Lee, I think if you were able to test an individual, a young child, you might be able to see that they're low in iodine, low in zinc, and high in aluminum. And that when I see a breakout like around the mouth, I know that their lymph nodes in their intestinal, in their stomach, abdomen are full of fungus. And so every time they breathe, they're getting the breakout around their mouth. So that if they're able to, get some iodine, it gets rid of the fungus. I found out that the Celts back in Scotland and Ireland, they used to store their oats in an area, and they had a lot of mold probably that was associated with it. But they used to take Irish moss and seaweed and mix it in as a salt with the oats, and so they could assimilate it better. But and that's the reason why it killed the fungus. And so iodine is your best way to, iodine tablets, but get tested first to
make sure you don't have an allergic reaction to iodine. Right. That's a big one.
Or that they may not have enough iodine, and they slowly have to work their way up. Mm-hmm. A lot of people are allergic to it because they have too much aluminum that is creating this reaction in their body.
Wow. Well, that's good to know. We're almost out of time. I want to give you and your wife just about a minute apiece. What do you want? I always like this. Leave our listening audience with. We'll start with ladies first. Elizabeth?
Yes, ma'am. Thank you. I think what I want to say basically is that we know we are living in a very toxic world. And as we mentioned earlier, we want to be able to at least live here in a healthful way. And since we're being bombarded with all kinds of toxins in air, food, water, medications, everything, the jewelry we talked about, we know that we can't avoid it. And the body is very dynamic. What it's telling us is you can't do this once and think we've taken care of the problem. You have to eat every day, and you should be eliminating every day. So we want to make sure that we keep the heavy metals at abeyance. And by doing a toxic, especially a topical toxic detox, you can live basically with an enemy, keeping it from being harmful to you at the same time you know that you're constantly having to maintain a healthy level of minerals and avoid the toxicity of the heavy metals.
Yes. Okay. Now we go to your wonderful husband, Michael.
I would, Dr. Lee, thank you for this opportunity.
Thank you.
I just got a call yesterday from an Oligoscan user, and I asked this person, what is your amount of sulfur conjugation that you find on the Oligoscan when you get a test? Mm-hmm. And she said to me it was, I think, 75%. So I asked her that, the connection that if her heel had a callus, because we're finding that if a heel on a foot is callous, it usually means that their sulfur is built up, that their lymphatics are not working good enough. And so she said, well, my heels are fine. I go to have my heels, have my feet done.
And have a pedicure, yes.
And she says, I have my heels ground down. So I would implore that anybody, if their heel is callous, and they need to give you a call because they need to get tested, because that's the first start of the heavy metals being blocked by gravity at the bottom of their feet. And we have seen the changes around the world that when we work with our product in the bottom of the feet first, and lymphatic legs start to open up through the skin, that we see the changes in the sulfur. Because if the sulfur is not working, you're not getting rid of heavy metals.
Exactly.
And this is part of what we've been teaching. And if they come in and get a test, they'll see it. So you'll connect that heel and you'll look at the sulfur. If 65 or greater, we have some work they need to do.
Wonderful. And I'm so glad that we have this scan at our office at New Wellness Healthcare. We're located in Marina Del Rey. People do come in for this scan, and we do so many others because, again, test and don't guess. Prevention is the key. I am just so elated that I've had both of you guys for 2 weeks in a row on the show. And if you are not able to watch the show, you're listening to it on iHeart or on UBN or any of our other outlets. We have about 6. iTunes. I want to thank you so much for listening. But if you want to see the show, you can also see it on our YouTube channel. New Wellness TV with Dr. Lee, and new is in you. In you is where wellness began. In you. New Wellness Healthcare. Thank you so much for tuning in today. And thank you, my guests, for taking the time out of your busy schedule to share such knowledge. Such knowledge. Now, repeat after me. I am
I
I
am
am
so eternally grateful
eternally grateful
that I am
that
that I am
a magnet for miracles.
a magnet for miracles.
Everyone have a wonderful, blessed day.
Join us every Wednesday live at 11 a.m. for New Wellness TV with Dr. Lee. Remember, healthy mind, healthy body.
We did it again. What do you think about the show?